Okay, so with this, we start the session for today. And so, before starting the session for today, I do have a good news for all of you, like some of you maybe. So, surgery I'll be taking. Okay? So, don't worry about that. We will be covering surgery in chanting sessions. And so, yeah, don't worry about that. Okay? So, surgery मुझ पे छोड़ दो, medicine will be covering again. But at least try to read surgery and then come to chanting sessions, because I could not cover all of the surgery in chanting session. So it is always recommended to go at least once through your notes and then come to chantings. Okay. Now starting with PSM, the first topic going according to your notes is the health system of India, guys. So if we talk about health system of India, first of all, the important question that has repeated multiple times has been declaration of PHC, that is declaration of primary health care. And declaration of primary health care was given in which conference? Declaration of primary health care was given in which conference, anybody? Very good. Alma-Ata conference. Which conference? Which conference? Alma-Ata conference in Kazakhstan in 1978. Important. हाँ, ये कजाकिस्तान वाला है, ठीक है? So, declaration of PSC was given in which conference? Declaration of PSC in? Declaration of PSC in? Alma-Ata conference. Important है, okay? Then in this conference, they actually gave the 4 A's of primary health care. And these 4 A's can definitely come as exception. Okay? All are the components of primary health care except, okay? And one of the A's can be changed. So can anybody tell me what are the 4 A's? First is acceptability. That means the primary health care should be acceptable to everyone. Second is affordability. That means the primary health care services should be affordable to each and everyone in the society. Third is availability. That means each and everyone in the society, for them the primary health care services should be available. Whereas last one is accessibility. That means for each and everyone in the society, the primary health care can be accessible. They can reach to the hospitals on time. Okay, these are the 4 A's of PHC. First is second is third is and fourth is last is accessibility. So the 4 A's of primary health care are acceptability, affordability, availability and accessibility. Okay? Don't forget this. Then talking about the next 12, that is principles of primary health care. And इस पे दो बार questions आ चुके हैं already. There are also elements, but on elements usually questions come in NEET PG examinations. Principles पे they definitely ask you questions. So the principles of primary health care are 4 in number, and they can be remembered by the mnemonic IACE. You will ace the FMJ exams, right? So they can be remembered by the mnemonic IACE. Okay, where I goes for intersectoral coordination. I for A for appropriate technology. A for C for community participation. C for and last E for equitable distribution. E for equitable distribution. These have come, and there is an exception. They had given all other principles of primary health care except, okay, and the options were intersectoral coordination, community participation, equitable distribution, and rather than appropriate technology, they gave one another option. Okay? Adequate technology they gave. Okay, yeah, adequate resources. So the 4 principles of primary health care. First is I for A for C for and E for equitable distribution. Okay, important. Then talking about the first referral unit. As we all know, in the Indian healthcare system has been divided into various levels or various strata. First is the village level, then is your sub-center level, then is your primary health center, that is PHC, then is your secondary level, that is your community health center, and tertiary level पे क्या आता है? District hospitals and medical colleges. Important. Okay, so in 3 strata usually it is voice is echoing. I hope it is fine now. पीछे वालों को आवाज आ रही है अभी भी? ठीक है. So please remember, in these 3 levels, primary, secondary and tertiary, the Indian healthcare system is divided. Can anybody tell me, according to this system, which is the first referral unit? First referral unit would be? Very good. It is your CHC, Community Health Center, that is secondary level. Important. First referral unit is? First referral unit is? First referral unit is? And this was a question asked, and most of us tend to make a mistake. We tend to mark it as a PHC, that is primary health center. Important thing to be remembered is they are asking about first referral center. That patient सबसे पहले refer कहाँ से होगा? So a patient first of all comes to a PHC and is then referred from there to CHC. Okay, so first referral unit would be? First referral unit is? First referral unit is? Second referral unit is? District hospital. Second referral unit is district hospitals. Important. Then talking about population norms. Previously there used to be questions regularly about population norms. We have seen it subsiding somewhat in the last 2 or 3 sessions. ठीक है? So if we talk about population norms, guys, in 4 के तो तुम्हें याद होने ही चाहिए, and that is important. Okay? So first of all, there are different population norms for plains and hill areas for each of these. Right? So first of all, we will talk about the Anganwadi center. Okay? So what is the population norm for Anganwadi center in plains? 1 per 400 to 800 population. 1 per. So Anganwadi center in plains? 1 per 400 to 800 बोलो. Anganwadi center in plains? Anganwadi center in plains? Whereas Anganwadi center in hilly area? 1 per 300 to 800. Anganwadi center in hilly area? Anganwadi center in hilly area? Anganwadi center in plains? Anganwadi center in plains? Don't forget this, okay? And this is the same population norm for the Anganwadi worker also. So Anganwadi worker in plains? Anganwadi worker in plains? Whereas Anganwadi worker in hilly areas? Anganwadi worker in tribal areas? 1 per 300 to 800. So hilly areas, tribal areas, or difficult to access areas. All of this, it is the same, the below one. Okay, important. Moving further, talking about the sub-center now. So the population norm for sub-center in plains is 1 per 5,000. 1 per 1 sub-center per in plains. 1 sub-center per. याद रखना, in plains 1 sub-center per, in hilly areas 1 sub-center per, in hilly areas 1 sub-center per, in plains, in hilly areas, in tribal areas 3,000. This is the population norm for sub-center, important one. Then moving further, guys, talking about the PHC, that is your primary health center. Primary health center in plains, 1 PHC for 30,000. 1 PHC for in plains, 1 PHC for in plains, 1 PHC for in hilly areas, 1 PHC for in hilly areas, 1 PHC for in tribal areas, 1 PHC for 20,000 population. Important. Whereas then last talking about CHC, that is community health center or your secondary level. Okay, important. So here 1 CHC in plains for 1,20,000. 1 CHC in plains for 1 CHC in plains for 1 CHC in plains for 1 CHC in hilly areas for 1 per 80,000. 1 per 1 CHC in hilly area. जल्दी बोल रहा हूँ, 1 पर बोलने की जरूरत नहीं है, कम से कम मुझे आंकड़ा बता देना, ठीक है, जल्दी से. आंगनवाड़ी सेंटर इन प्लेन्स Anganwadi center in hill area. Anganwadi center in plains. Sub center in plains. Sub center in plains. Sub center in hill area. Sub center in hill area. PHC in plains. PHC in plains. PHC in hill area. PHC in hill area. CHC 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 in plains. चाय मंगानी. Moving further, आगे देखते हैं. Now you need to be well acquainted with the healthcare workers and the level. ठीक है? So first of all, आंगनवाड़ी सेंटर पे कौन सा हेल्थकेयर वर्कर होता है? आंगनवाड़ी वर्कर. आंगनवाड़ी सेंटर पे आंगनवाड़ी वर्कर. आंगनवाड़ी सेंटर पे सब सेंटर पे भाई आशा से क्या प्यार है इतना? कौन है आशा? सब सेंटर पे मल्टीपर्पज वर्कर. सब सेंटर पे पीएचसी पे यहाँ सब ब्लैक है ना. और कुछ हेल्थ वर्कर और कुछ कोई तो एक सवाल कोई तो एक दे दो आंसर. नोबडी. मैं चॉकलेट खा लेता हूँ. ठीक है. हेल्थ असिस्टेंट एट पीएचसी वी हैव पीएचसी पे हेल्थ असिस्टेंट एट एमपीडब्ल्यू एट आंगनवाड़ी वर्कर एट. Then CHC पे usually we have a group of people. Almost there are 46 to 52 staff over there, which includes your specialist also. Okay, along with that you have medical officers, MBBS, medical officers from Ayush also. You have your nursing staff as well. Okay, so don't worry about that. At least ये याद रख लो. Then talking about healthcare workers, these two are the most important on which repeatedly questions have been asked. So if we talk about ASHA first, सबसे favorite तुम्हारी, that is accredited social health activist. What is the full form for ASHA? Accredited social health activist. She is located at which level? Village level. ASHA is located at village level पे कौन सा healthcare worker? ASHA worker. Important. Okay. Then what is the population norm for ASHA worker? 1 per 1000 वाले हाथ ऊपर करो. 2 per 1000 वाले हाथ ऊपर करो. It is 2 per 1000 now. Please remember the target is to reach 2 per 1000 ASHA workers now. We have already reached the target of 1 per 1000 ASHA workers. So the population norm for ASHA worker is 2 per 1000 population. Then ASHA should be a resident of the same village. And she is elected by anybody? Yes, she is elected by the panchayat. Okay, and she is a member of the village health and sanitation committee. She is a member of health and sanitation committee. टॉयलेट बनवाएगी पूरे इसमें. ठीक है. An important thing, she is responsible for 2 things. Important सबसे ज्यादा जिस पे questions आ चुके हैं. Okay, she is a dot provider. And second, she is responsible for contraceptive distribution. She is responsible for. So ASHA worker is elected by the Gram Panchayat. She is responsible for 2 important functions. First is dot provider, and second is contraceptive distribution. Can anybody tell me, does ASHA worker does she conduct deliveries? No. This is the important question which has been asked. Okay. So there was exception from the functions of ASHA worker, and they had given one of the options as she conducts delivery. So please remember, ASHA worker does not conduct delivery. ASHA worker does not conduct delivery. So who conducts deliveries then? So deliveries are usually conducted by anybody. Deliveries, very good. Deliveries are usually conducted by either auxiliary nurse midwife, that is ANM, or multipurpose worker female, along with the help of traditional birth attendant. Important. Delivery is conducted by MPW female. Delivery is conducted by ANM or MPW female, or delivery is conducted by ANM or MPW female, or along with traditional birth attendant. Important. Traditional birth attendant is located at which level? Village level. TBA at MPW at sub center. Don't forget this. This question has been asked and हर बार गलती करते हो. Multipurpose worker female is located at multipurpose worker male is located at sub center. So please remember, usually multipurpose workers are located at which level? Multipurpose workers are located at which level? Multipurpose worker का concept was given by which committee? This question has been asked. The concept of multipurpose worker. Very good. Multipurpose worker has a union, and एक साथ कौन आते हैं? Punjabi. So therefore it is Kartar Singh committee. Okay, they are united, right? So please remember, multipurpose worker female का multipurpose worker का concept was given by multipurpose worker का concept was given by multipurpose worker का concept was given by Kartar Singh committee. Important. And multipurpose worker is located at which level? C. Then moving further, multipurpose worker male होता है और female होता है. Multipurpose दोनों होते हैं, मैं बता रहा हूँ. Multipurpose worker male has an important function of very good peripheral blood smear peripheral blood smear. So he prepares the malarial slides, that is for peripheral blood smear. So please remember, MPW male prepares he prepares the peripheral blood smear slides for malaria. Okay, important. And MPW female, she conducts. MPW female conducts. MPW male is responsible for malaria slide preparation. MPW male is responsible for malaria slide preparation. So malaria slides are prepared at which level? Malaria slides are prepared at which level? But they are examined at. This was a question in NEET PG. They are examined at PHC. They are prepared at sub-center. Prepared at, examined at, prepared by multipurpose worker male. Important. And multipurpose worker female, along with conducting deliveries, she has the important function of maintaining the eligible couple register. She maintains the eligible couple register. Moving further. Now talking about next one, that is health planning committees. ठीक है? So health planning committees की अगर बात करें, I have explained this in great details with some mnemonics to remember in PSM session. So you can refer to the last session of mine. PSM planning committees में at least these four are important. So please tell me, Bhor committee bored us with 3 months of PSM training. Bhor committee bored us with 3 months of compulsory PSM training and internship. अभी वो 2 months हो गया. Pehले it was 3 months recommended by them. Important. And they also worked on school health. So which committee worked on school health? Bhor committee. And which committee worked on comprehensive school health? Very good. It was Renuka Roy committee. Comprehensive school health पे Renuka Roy committee. Whereas school health पे first committee that worked was Bhor committee. School health के first committee that worked was board committee. Board us with 3 months of PSM training. Important दो चीजें याद रख लो. Next was your चड्ढा committee. चड्ढा चड्डी में सो रहा था and therefore उसको क्या काटा? अच्छा काटा. Therefore he worked on the National Malaria Elimination Program. चड्ढा worked on. चड्ढा committee worked on. चड्ढा committee worked on. चड्ढा committee worked on malaria. Next was Mukherjee committee. So Mukherjee को लगा बंगाल में अपनी population बहुत ज्यादा है, so we need to control that. Therefore they worked on family planning. Previously malarial program and family planning program was single, so they actually worked on delinking the National Malaria Elimination Program and family planning program. Important. So Mukherjee worked on malaria and family planning. Mukherjee worked on Mukherjee worked on Mukherjee committee on. So Mukherjee committee delinked both programs, that is National Malaria Elimination Program and Family Planning Program of India. I hope this is clear. Next is Kartar Singh committee, and Kartar Singh committee gave the most important recommendation of. Kartar Singh committee gave the important recommendation of. Kartar Singh committee gave the recommendation of multi-purpose worker. Yeah, important. So board committee board us with 3 months of PSM training. They worked on school health. Comprehensive school health पे किसने काम किया? रेणुका रॉय committee. चड्ढा committee worked on National Malaria Elimination Program. Mukherjee committee delinked National Malaria Elimination Program from Family Planning Program. And Kartar Singh committee gave the recommendation of multi-purpose worker. At least these one-liners you should know. Moving further, what is this logo for? This is the logo for your. So this is the logo for your Ayush. Okay, Ayush is actually a department for alternative forms of medicine under the Ministry of Health and Family Welfare, where A stands for Ayurveda. A for Y for yoga and naturopathy. Y for U for Unani. U for S for Siddha. S for and H for homeopathy. H for homeopathy. So this Ayush department comes under which ministry? Ministry of Health and Family Welfare. Please remember the logo, that is important. ठीक है? Asclepius तो है ही. Along with that there is like पेड़ पौधे हैं ना, तो आयुर्वेदा याद रह जाए. Moving further, because please remember there would be nothing as such written over there. Okay, logos usually अगर exam में नहीं पता कैसे आते logos, so nothing would be written. Only Sarve Santhu Nirama would be written. Ayush Vibha would also not be written. Okay, only that tagline would be there. Sarve Santhu Nirama. Everyone should be healthy. Moving further, talking about this next important one. This logo is for your National Health Mission. This logo is for your National Health Mission, NHM, Rashtriya Swasthya Mission. So this is for your NHM, launched in the year 2013. Launched in the year NHM was launched in the year. Previously we had National Rural Health Mission and National Urban Health Mission. Both of them were combined together to form which mission? National Health Mission, launched in the year 2013. Important. Okay. So according to this National Health Mission, it is actually an umbrella program. Okay, please remember it is actually a umbrella health program for which includes all the other health programs. Okay, it includes all the other health programs. All other health programs are a part of National Health Mission. Okay, one of the program name is RMNCH plus A. Okay, one of the program name is RMNCH plus A, where R stands for reproductive health. R stands for MN for maternal and neonatal health. MN for CH for child health. CH for and plus A. They had asked a question. Plus A in RMNCH plus A stands for, and that stands for adolescent health. A stands for तो नहीं बोलोगे RMNCH. R for reproductive health, M for maternal health, N for neonatal health, CH for child health, and plus A for adolescent health. Adolescents are children between 18 They are between 10 to 19 years of age. Please remember, adolescents means children between 10 to 19 years of age, and this was also a question which has been asked. Adolescent age group is from 10 to 19 years of age. Adolescent is from 10 to 19 years of age. Important. Next, if we talk about the major targets of this National Health Mission, so the major targets of this National Health Mission, or the goals we can say, first are to decrease MMR, maternal mortality rate. Second is to decrease IMR, infant mortality rate, and third is to decrease the total fertility rate, TFR. Okay, so what is the target? Can anybody tell me? To decrease MMR less than 100 per 1 lakh live births. To decrease MMR less than, to decrease MMR less than, to decrease MMR less than 100 per 1 lakh live births. Important. Okay, important is this. Next, to decrease IMR less than, to decrease IMR less than 25 per 1000 live births. To decrease IMR less than, to decrease IMR less than, and to decrease TFR to 2.1. To decrease TFR to, important. अरे क्या हो गया? जाननी बच्ची क्या हुआ? क्या है? So the National Health Mission has major targets. First is to decrease MMR less than, to decrease MMR, to decrease MMR less than 100 बोलने में क्या जा रहा है तुम्हारा? To decrease MMR, to decrease IMR, to decrease IMR, and to decrease TFR to. Now tell me the current values of India of MMR, IMR and TFR. I am asking according to the recent sample registration survey conducted in May 2020, because this is the recent most data that we have. ठीक है, सेंसस का नहीं पूछ रहा मैं, मुझे MMR का SRS का डेटा बताओ जल्दी. MMR according to the SRS is 113 per 1 lakh live births. MMR according to SRS 20 is MMR, recent MMR is 113 per 1 lakh live births. ठीक है, there are 113 maternal deaths per 1 lakh live births. Next, what is the current IMR of India? Current IMR of India is, current IMR of India is, current IMR of India is, and current TFR of India is 2.2. Current TFR of India is 2.2. Are you not aware of these values first? You should be. Okay, these questions can be asked. So important. What is the current MMR value of India? 113 per 1 lakh live births. What is the current MMR value of India? What is the current MMR value of India? What is the current IMR value of India? What is the current IMR value of India? And what is the current TFR value of India? 2.2. कोई issue नहीं है यहाँ तक. Moving further. Talking about the next logo that we have, and this is for Pradhan Mantri Jan Arogya Yojana, also known as PM-JAY, and this scheme is known as Ayushman Bharat scheme. This scheme is known as, this scheme is known as Ayushman Bharat scheme, an important scheme. Okay, so this is a major national health protection scheme. This is a national health protection scheme. कौन सी scheme है? तो आयुष्मान भारत is a, Ayushman Bharat is a national health protection scheme. Important. ठीक है, this is the logo. Okay, so this is the logo for Ayushman Bharat scheme. Question has been asked in June 2021 right now, and they had asked, according to this Ayushman Bharat scheme, what is the monetary cover or the health cover given to the BPL families? Usually Ayushman Bharat scheme is run for the below poverty line families, right? And they are given a health cover of how much money? 5 lakh per family per year, not a person. Important. Okay, so Ayushman Bharat scheme gives a health cover of 5 lakh per family per year. ये बोलना है. Ayushman Bharat scheme gives a health cover of, Ayushman Bharat scheme gives a health cover of, Ayushman Bharat scheme gives a health cover of, Pradhan Mantri Jan Arogya Yojana gives a health cover of 5 lakh. नाम बदल दिया, that does not mean the program has been changed. It is the same name for the program. Okay, so Pradhan Mantri Jan Arogya Yojana, it is just another name for Ayushman Bharat scheme. I hope this is clear. ठीक है, don't forget it. So अगर आयुष्मान भारत स्कीम नहीं है ऑप्शन में, there would be प्रधानमंत्री जन आरोग्य योजना. Okay, important. Then according to this program, usually 10 plus crore families are given this opportunity and 50 plus crore population has got benefit from this. ठीक है, कोई इशू नहीं है. ये 5 लाख वाला पॉइंट बहुत याद रखना है और ये इमेज याद रखनी है उसके लोगों वाली. Moving further, now a very important topic, and the first logo is for नाम लिखा हुआ है ऊपर, National Tuberculosis Elimination Program. The logo is for NTEP. The logo is for National TB Elimination Program. Important logo because this logo has now currently been changed in 2020. ठीक है, and that is the reason why there is a high probability to ask this. And TB, as we all know, is a very common disease in India. So, can anybody tell me? Definitely, अगर ये logo आएगा, the National Tuberculosis Elimination Program, that would not be written on the logo. TB मुक्त भारत, if they want to help you out, they can write it. Otherwise, they can cut that also part. Okay. So please remember, here you can at least find the lungs. ठीक है, उससे तुक्का लगा लो. If lungs are present, then it is the TB program. That is National Tuberculosis Elimination Program. It is a newer name for which program? Anybody? It is a new name for which program? या फिर इस program का पुराना नाम क्या था? What was the old name for this program? Very good. The older name for this program was RNTCP, Revised National TB Control Program. The older name was. The newer name is NTEP. That is National TB Elimination Program. Important. Okay. According to this program, what is done for screening of TB? First of all, which people undergo TB screening? Which symptoms? Symptoms बताओ. Cough more than equal to 2 weeks. Cough more than equal to 2 weeks. These people are actually sent for TB screening. Okay, cough or fever more than equal to 2 weeks. And what is the first line screening test? First line screening test. It is usually a chest X-ray or a sputum smear examination. It is a chest X-ray or sputum smear examination or chest X-ray. These are the first line screening tests that we run for TB. Whereas what is the investigation of choice? CB-NAT. Investigation of choice for TB is? CB-NAT. And screening tests are chest X-ray or sputum smear examination. Important. In sputum smear examination, how many samples are taken? 2 samples. How many samples? 2. One is a spot sample and second is a early morning sample. Important things. Then next we have this logo, and this logo is for this logo. This one. नाम लिखा हुआ है. This logo is for DOTS. This logo is for DOTS is what? Directly observe treatment short course. What is DOT? PSM में यही गलती करते हो. अगर तुम शॉर्ट फॉर्म्स याद रखते हो ना, इस बार अगर थोड़े बहुत एब्रिविएशंस के फुल फॉर्म्स पता होते तो आंसर करेक्ट करके आ जाते. ठीक है. So please remember, at least try to remember the full forms. Those are easy and definitely they will help you in exams. So try to remember the full form. DOTS का full form क्या है? Directly observe treatment short course. That means a healthcare worker will observe that the patient is taking the tablet or not. This is what it means in literal terms. So DOTS is what? Directly observe treatment short course. It is for which disease? Tuberculosis. It is for which disease? Tuberculosis. So this is the logo for DOTS. Usually DOTS would be Gaia, and here, this can be written. Pura course, pakka ilaj. Okay, pura course, pakka ilaj. Okay. Now this DOTS, actually there is a new ICT based system. Okay. So a computer based system has been started for DOTS, which is known as DOTS. A computer based system of DOTS is known as DOTS 99. A computer based system of DOTS is known as and DOTS 99 is to increase the compliance of anti-tubercular therapy. कि patient दवाई ले ले. To increase that, we actually have DOTS program in TB. Okay, important one. Whereas the second one you are confused with, this is a online portal. Okay, this is a online portal for anybody. Monitoring and surveillance of TB cases. It is online portal for It is the online portal for monitoring and surveillance of TB cases. So which is the online portal for monitoring and surveillance of TB cases? NICSHAI. Ni means eradication, Kshay means tuberculosis. So this portal known as NICSHAI is just an online portal started for monitoring and surveillance of tuberculosis cases. Whereas for treatment we have DOS. ट्रीटमेंट के लिए मॉनिटरिंग के लिए NICSHAI. So this should be clear. Okay, this is known as NICSHAI. Okay, it is an online portal started for monitoring and surveillance of tuberculosis cases to keep a track on all the TB cases. Okay, moving further. No issue still here with TB. Moving further now, what is this logo stands for? प्रोग्राम का नाम क्या है? So this logo stands for Integrated Child Development Services. This logo stands for ICDS or Integrated Child Development Services. Integrated Child Development Services में usually the beneficiary is a mother and her child. Okay. Along with that, there are also other beneficiaries like children less than 5 years age. Okay, the school-going children and the adolescent girls. Okay, important one. So this comes under which ministry? Integrated Child Development Services come under which ministry? Ministry of Women and Child Development. So ICDS comes under which ministry? ICDS comes under which ministry? Women and Child Development. Important question. Next, what is the heart of ICDS activities? So now in ICDS, as I told you, there are different beneficiaries. That means children less than 5 years old, school-going children, adolescent girls only. Then after that, adolescent boys को भी दिया जाता है, and reproductive age group females, mothers and their children. Important. Okay. So these are the beneficiaries of your ICDS activities, Integrated Child Development Services, under the Ministry of Women and Child Development. So according to this scheme, which centers were started in India? Very good. Anganwadi centers were started after this scheme. So please remember the heart of ICDS would be Anganwadi center. Heart of ICDS is so each and every activity usually of ICDS is conducted at the Anganwadi center. Therefore, the heart of ICDS would be, whereas functional unit of ICDS would be, very good. It is community development block. Functional unit of ICDS is community development block. Functional unit of ICDS is community development block. Whereas heart of ICDS, community development block consists how many villages? It comprises of so one community development block is made up of 100 villages or 1 lakh population. Or so one community development block is made up of how much population? One community development block is made up of how much population? And how many villages? How much population? Important. Moving further. No issue still here with this. Then moving on to the next image. What is this? Very good. This is a infantometer. Okay. This image is a infantometer. It is used to measure. It measures length. And length is measured less than 2 years of age. Length is measured less than 2 years of age. And it is measured by which instrument? Whereas after 2 years of age, क्या measure करते हैं? After 2 years of age we measure, and it is measured by stereo. It is measured by height is measured by length is measured by less than 2 years we measure length, more than 2 years we measure. No issue. An important question have been coming in examination. What is this instrument? So this is a field instrument used by the healthcare workers on field to assess. Anybody? So please remember, yes, the name of this instrument is. The name of this instrument is. The name of instrument is Chartier's tape, which is used to measure. It is used to measure mid-arm circumference or mid-upper arm circumference, and mid-arm circumference is an indicator of malnutrition. Mid-arm circumference is an indicator of. Mid-arm circumference is an indicator of. So usually Chartier's tape is used for assessment of malnutrition in the community. No issues with this. Okay. So it has three colors or three zones: green zone, yellow zone, and red zone. Green zone is more than 13.5 centimeter. Green zone is more than. Green zone is more than. That means normal children. Then yellow zone is from. Yellow zone is from. Yellow zone is from 12.5 to 13.5. That means borderline. And red zone is from. Red zone is from less than 12.5 centimeter, which tells us about malnutrition. Okay, no issues till here. Next one. What is this image? This had come earlier in NEET PG. So the healthcare worker, a Anganwadi worker, is trying to measure weight of this child, and this weight measuring instrument on field is known as. It is a spring balance instrument known as Salter scale. It is known as. This instrument is known as Salter scale. Okay, it is used to measure. It is used to measure. जो लिख रहा हूँ वो जरूरी नहीं वो पूछ रहा हूँ, ठीक है? It is used to measure weight. Which is the field instrument used to measure weight? Which is the field instrument used to measure weight? Which is the field instrument used to measure mass? Mass, mid-arm circumference. Which is the field instrument used to measure mass? Which is the field instrument used to measure length? Which is the field instrument used to measure height? No issues with this. Moving further. Now, what are these? Anybody? Growth charts given by ICDS or WHO? So please remember, these are ICDS growth charts. These are ICDS growth charts used in India only. Okay, these are ICDS growth charts. Pink one for girls, blue one for boys. Okay, it has three zones again: green, yellow, and red. Green zone is known as. This was asked earlier. Green zone is known as. Very good. Road to health. Green zone is known as. Green zone is known as road to health. Then they have also asked questions on upper reference curve and lower reference curve. Upper reference curve of this chart is anybody? Which percentile? 50th percentile of anybody? 50th percentile of boys. Whereas lower reference curve is the 3rd percentile of girls. Important. So, according to the ICDS growth chart, upper reference curve is 50th percentile of boys. Upper reference curve is रट लो भाई, समझने के लिए नहीं बोल रहा हूँ मैं, बस रट तो लो. अपर रेफरेंस कर्व है and lower reference curve है, lower reference curve है, lower reference curve है, and these charts are given by ICDS activity. Okay. The next image that you have, it is a logo for which Abhiyan? Poshan Abhiyan. This is a logo for Poshan Abhiyan. Poshan Abhiyan has an aim to decrease malnutrition. It has an aim to decrease. So it has an aim to attain a malnutrition-free India by the year 2022, which seems impossible anyways. But yeah. So please remember, this is which Abhiyan? Poshan Abhiyan. So the program which has been started by Government of India to decrease malnutrition is known as Poshan Abhiyan. It is Prime Minister's overarching scheme for holistic nourishment. Okay. And यहाँ पे tagline होगा definitely. So it would be easy for you. Sahi Poshan, Desh Roshan. Okay, important. Usually होती है, but at times अगर मैं बोला हमको अगर tough करना हो तो निकाल भी सकते हैं. It depends completely on their will. उसका झगड़ा ना हुआ हो, बस घर पे ये pray करके आना. Next one, what is this logo for? This logo is for the This logo is for the midday meal scheme. And midday meal scheme comes under which ministry? This is the question. Midday meal scheme comes under which ministry? यहाँ पे क्या दिख रहा है? In government schools, if you are aware of that, children are provided food in the recess, right? Along with studies, you need to take care of their nutrition also. This is the main aim behind this midday meal scheme. So midday meal scheme is started by Ministry of midday meal scheme comes under Ministry of Education. Midday meal scheme comes under Ministry of midday meal scheme under Ministry of midday meal scheme under Ministry of midday meal scheme under Ministry of Education. Important. Previously it was known as the HRD Ministry, Human Resource and Development Ministry. ठीक है? No issues till here? I hope no issues. Then according to this, one more question that has come, or rather it has come thrice in the examination, that is, according to the scheme, how much calories are being given to children and how much proteins are being given to children of the recommended daily allowance. So जो recommended dietary या daily allowance होता है, out of that, how much calories and how much proteins are being given under the scheme. So how much calories? How much calories? How much calories? And how much proteins? How much proteins? Half of the proteins of the recommended daily allowance are being given. Okay, how much calories? How much calories? How much proteins? Half proteins of the recommended daily allowance are being given to children under this scheme. ठीक है, खिचड़ी खाइए कभी नहीं खाइए? ठीक है, no issues. मतलब स्कूल से मिलने वाली ये वाली बोलो. Moving further, next topic or the next logo that you have, that is JSSK. This scheme is known as Janani Shishu Suraksha Karyakram. Janani means mother, Shishu means newborn. ठीक है? और child actually. So it is a scheme for your mother as well as a newborn. So Janani Shishu Suraksha Karyakram usually has some maternal benefit and some neonatal benefits. So according to this Karyakram of this program, usually the female is given free delivery. The female is given free delivery, and the mother as well as the child are given free diagnostics, free medicines, free diagnostic, free medicines, free diet, and lastly free transport. But free transport, this was a question in NEET PG. Free transport from the home to the hospital during emergency, not from hospital to home. मन में आया बोल दिया यार घर पे छोड़ के आ जाओ, मन नहीं किया ऑटो से जाने का, ऐसा नहीं चलेगा. ठीक है, जस्ट फ्रॉम द होम टिल द हॉस्पिटल इन केसेस ऑफ इमरजेंसी सिचुएशंस. ठीक है, व्हेन द फीमेल इज अबाउट टू डिलीवर. It is Janani Shishu Suraksha Karyakram usually has a aim to increase the number of institutional deliveries, and that is why all these free services are being given. Okay, so free delivery, bolo free delivery, free diagnostics, free medicine, free diet and free transport are being given under this scheme which is known as Janani Shishu Suraksha Karyakram. Don't confuse this image with kangaroo mother care. ठीक है, वहाँ रियल इंसान दिया जाएगा तुम्हें, वो बताता हूँ मैं बाद. Moving further, this is a logo for very good. So यहाँ पे क्या दिख रहा है? मच्छर. Okay, a mosquito is seen and the family is protected from the mosquito. So this is actually a logo for National Vector-Borne Disease Control Program. This is a logo for National Vector-Borne Disease Control Program. Under this program, which diseases come usually? Vector-borne diseases like malaria, dengue, filariasis, chikungunya fever, Japanese encephalitis, and Kala. No issues till here. Then tell me which is the most common vector-borne disease. Very good. Which is the most common vector-borne disease? The most common vector-borne disease is? The most common viral vector-borne disease is? Viral vector-borne. As we all know, malaria is caused by a parasite. Malaria is caused by a parasite, Plasmodium species, right? So viral अगर आता है, most common viral vector-borne disease is dengue. Most common viral vector-borne disease is dengue. Most common arboviral vector-borne disease is again dengue. Most common arboviral vector-borne disease is dengue. Anybody? So just for my knowledge sake, in malaria elimination program in India, we have a program, right? National Malaria Elimination Program. Two questions are important. First, which stain is used for Plasmodium species? Which stain is used for malaria? For preparation of malarial slides, which is the stain used? सब में ऑप्शन देता बैठना है. जसवंत सिंह भट्टाचार्य stain. Which stain? Which stain? Which stain? एक ही इंडियन नाम है यार. जसवंत सिंह भट्टाचार्य stain. Which stain? So for malarial slide preparation, which stain is used? JSP, that is Jaswant Singh Bhattacharya stain. And second, the rapid malarial antigen test RMAT जिसको बोला जाता है. It is dependent on, and this question had come earlier. It is dependent on which protein? Anybody? It is dependent on, किसी को याद नहीं आ रहा ना? It is dependent on Plasmodium falciparum histidine rich protein type 2. It is dependent on histidine rich protein type 2. Reflogemin line RMAT is actually dependent on Plasmodium falciparum histidine rich protein type 2. HRP बोलो. So malaria के स्टेज कौन सा यूज होता है? Malaria के स्टेज यूज है JSP, and it is dependent on which protein? Plasmodium falciparum histidine rich protein type 2. Important thing. Okay. Then dengue के लिए, for dengue antigen test, which is the antigen used for detection? For dengue detection, which is the antigen used? नाम भी है टेस्ट का वही. NS1 antigen. Which is the antigen used for dengue? Which is the antigen used for dengue? Which is the antigen used for dengue? And for malaria it is PF-HRP type 2. No issues till here. For detection की बात कर रहा हूँ. ठीक है? I hope at least you can do these things. Again, one more thing to be covered over here. Drug of choice for filariasis. इसका क्वेश्चन आ चुका है. Drug of choice for filariasis है. Drug of choice for filariasis is diethylcarbazine. Drug of choice for filariasis is drug of choice for filariasis is drug of choice for filariasis is. And a question from FMGQ in 2020. Microfilariae in filariasis are not present in which bodily secretions? Answer was saliva. It is not present in saliva. ठीक है? गलत मत कर देना अगर रिपीट होता है क्वेश्चंस तो. रिपीट क्वेश्चंस तो कभी गलत नहीं होने चाहिए. नेक्स्ट, मूविंग ऑन टू दिस. व्हाट इज दिस लोगो? अ पर्सन इज होल्डिंग लोटस. A person is holding lotus in the hand. Sun is rising from behind. So very good. This is a logo for National Leprosy Eradication Program. National Leprosy Eradication or Elimination Program. Important. ठीक है? क्योंकि एलिमिनेशन हमने कर दिया है, so sometimes we tend to use elimination हमने कर दिया, so sometimes we tend to use eradication term also. So what is this was a question which has been asked in leprosy. What is the level for elimination? Because please remember, WHO has not told that. Please remember, if there are zero number of leprosy cases, then you can declare a country as eliminated from leprosy. So please remember, there is a level for leprosy elimination. And what is that level? Less than 1 case per 10,000 population. So what is the level for leprosy elimination? Less than 1 case per. What is the level for leprosy elimination? What is the level for leprosy elimination? So if there is less than 1 case per 10,000 population, leprosy can be termed or declared as eliminated from that country. And India has achieved this target. Now the current status of India is 0.63 cases per 10,000 population. Okay? So therefore we are leprosy. We have eliminated leprosy. Important. Then what is the treatment of choice for leprosy? Anybody? Drug of choice नहीं पूछा, treatment of choice पूछ रहा हूँ. मैं फार्मा नहीं कर रहा. MDT, that is multi drug therapy. Treatment of choice for leprosy is treatment of choice for leprosy is treatment of choice for leprosy is multi drug therapy. Green and violet color blister packs can come in the examinations as images also. Important. Okay, and 3 drugs used are Dapsone, Rifampicin and Clofazimine. Dapsone, Rifampicin and Clofazimine. Important. Moving further. This red ribbon stands for क्या? किसके लिए? So this red ribbon stands for HIV awareness. This red ribbon stands for HIV AIDS बोल दो. This red ribbon stands for whereas pink ribbon stands for breast cancer awareness. Pink ribbon stands for याद रखना. And HIV से questions आ सकते हैं important वाले. That we have the first case of HIV in India was in the city of Chennai. First case of HIV was seen in India in Chennai in the year 1986. In the year 1986, and therefore from 1987 we started a unit called as NACO, National AIDS Control Organization, and they have a program as NACP, that is National AIDS Control Program. No issues till here, at least ये याद रख लो. Okay, red ribbon is for HIV or AIDS awareness. First case in India was seen in Chennai in the year 1986. Then in 1987, NACO was started. Okay. Yeah, right. Then moving further, moving on to the next one. This is the logo for. So if there's a white square, white color cross, that is usually for first aid. And if there is a white colored cross with a dot in between, अगर बिंदी लगी हुई है बीच में, this is actually Suraksha Clinic. And people tend to make mistakes in this one. FMG December 2020 question, multiple mistakes have been done. So please remember, this logo is for, and the above one is for, with bindi, वैसे याद रख सकते हो, with bindi, without bindi, first aid. Actually, that is the trick to remember. So Suraksha Clinic, ठीक है? So Suraksha Clinic actually gives services for sexual and reproductive health. So for all the reproductive and sexually transmitted infections, services are given at Suraksha Clinics. This is a very important question. Important. Logo बहुत ज़्यादा important है इसका. Then this is again an important question from Suraksha Clinic. In Suraksha Clinic, usually we have these various types of kits available. Okay, so these color-coded STI or RTI kits are available at Suraksha Clinics to treat different syndromes. Okay, depending on the syndromic diagnosis, you can treat the patient. ठीक है? Kit 1 is a grey colored kit. Grey is used for urethral discharge or cervicitis. Grey is used for grey colored kit is used for. Then green colored kit is used for hara bhara, that is vaginitis. Green colored is used for vaginitis. ठीक है? Usually I remember by trichomoniasis, green colored frothy discharge. Next, white and blue are for genital, white, blue, red are for genital ulcer. WBR is a mnemonic for anybody. WBR is also a mnemonic for color changes, white, blue, red. Raynaud's phenomena. So please remember, वो भी mnemonic है ये. White, blue, red. WBR is a mnemonic for Raynaud's phenomena also, which is a very common question in FMG. ठीक है? So then white, blue, and red kits are for white, blue, and red for white, blue, and red for. Then yellow for lower abdominal pain, which is mainly suggestive of pelvic inflammatory disease (PID). Yellow for white, blue, red for, green for, grey for, and lastly black for scrotal swelling. Out of these, which are the most common ones? Grey, green, okay, and red has been asked. Red, it is for herpetic genital ulcer, whereas the rest two are for non-herpetic genital ulcer. So these three are the most important. And yellow also. Yellow has been asked in names. ठीक है? So these four are at least important. So for जल्दी मैं पूछता हूँ, मुझे कलर बताना है किट का. ठीक है? Urethral discharge, cervicitis, vaginitis, cervicitis, PID, lower abdominal pain, herpetic genital ulcer, scrotal swelling, no issues. Moving further, ये बहुत इंपॉर्टेंट है. ये और सुरक्षा क्लिनिक, इन दोनों में से एक क्वेश्चन बार बार आता रहता है. ठीक है? Moving further to the next one. What is this logo for? So this is the logo for the switch program. This is the logo for the switch program. Switch will not be written, only this would be given, and it is easy to actually recognize it. So please remember, the switch was a program in which all the countries changed from trivalent OPV vaccine to a newer bivalent OPV vaccine, because WHO declared that which strain of polio has been eradicated from the world. So P2 strain of polio has been eradicated. P2 strain has been Therefore, we change from trivalent OPV to bivalent OPV, and this program is known as switch. This program is known as switch, and the National Switch Day of India is very good. National Switch Day of India was 25th April 2016. National Switch Day of India is National Switch Day of India is National Switch Day of India is Moving further. Next one. What is this? ILR. That is the Iceland. What is this? Iceland. What is this image? Iceland refrigerator. And ILR is usually located at which level? PSC. ILR is located at ILR is located at Then what is the temperature maintained in ILR? What is the temperature maintained in ILR? What is the temperature maintained in ILR? 2 to 8 degrees Celsius. And this is the temperature used for storage of vaccines. This is the temperature used for storage of vaccines. And this is known as cold chain. This is known as the cold chain. Important. BJP? Pata nahi kya. Moving further. So ILR is located at which level? What is the temperature of an ILR? 2 to 8 degrees Celsius. Important one. Okay. Then ILR can sustain without electricity for ILR can sustain or ILR can work without electricity for 5 days. ILR can work without electricity for ILR can work without electricity for ILR can work without electricity for 5 days. And which is the healthcare worker who will do temperature recording of ILR? Who is the healthcare worker who will do temperature monitoring of ILR? At PSC, who is the healthcare worker? Health assistant. Important. Temperature recording is done by health assistant, and temperature recording should be done every. So it is done twice a day. Temperature recording is done twice a day. Important one liner. Next, and temperature is recorded by this dial thermometer. What is this? Temperature is recorded by dial thermometer. This is the image which can be asked. Okay, that is the ILR. Important. No issues in ILR. I hope everybody is quite aware of it. Next image. This is a question of recent INCET also. Questions have been repeatedly asked in every examination from this. What is this? Anybody? This is a vaccine vial monitor. What is this? Vaccine vial monitor. And vaccine vial monitor is an indicator of vaccine vial monitor is an indicator of heat sensitivity of a vaccine. Vaccine vial monitor is an indicator of heat sensitivity of a vaccine. So please remember in this, if the temperature of the vaccine vial is not maintained, okay, it should be maintained between 2 to 8 degrees Celsius. But if this temperature is not maintained adequately, so what will happen? This which is the marker or the VVM which is present on the label or sometimes on the cap, it will try to change its color. Okay, the inner square is usually lighter in normal conditions. Okay, if the temperature is maintained, it will remain lighter. But if the temperature is not maintained, it will keep on changing its color. Okay, and when should be the vaccine discarded? This was a question which has been asked. In which condition should be the vaccine discarded? 3 and 4. Okay, if this is 1, 2, 3 and 4, vaccine should be discarded at? So please remember, when the inner square color becomes equivalent to the outer circle, ठीक है, same color का जब हो जाता है ना, और if it becomes even more darker, that is the time you need to discard the vaccine vial. Important, ठीक है? So important, very important. So vaccine vial should be discarded when the inner square is of same color. When the inner square is of same color or darker. Important. And this is known as the vaccine vial monitor, which is an indicator of heat sensitivity of a vaccine. No issues with this. Easy. They can definitely ask you. For example, the second one can be given, and they have asked you that shall the nurse or the paramedical worker discard the vaccine vial or not. So what will be your answer if this one is given, the second one? No, it should not be discarded. If fourth one is given, then yes, the vaccine vial should be discarded. No issues till here. I hope this is fine. ऐसा ही questions usually आते हैं. Moving further, what is this now? This is a ice pack. What is this? Ice pack. Ice pack can contain how many vaccine vials? Ice pack can contain how many vials? 2 vials. What is the temperature maintained at ice pack? कोल्ड चेन का टेम्परेचर कितना होता है? कोल्ड चेन का टेम्परेचर है, कोल्ड चेन टेम्परेचर है 2 to 8 degrees Celsius. Important. Okay. So ice pack also maintains a temperature of 2 to 8 degrees Celsius. For how much time? It can maintain temperature for how much time? It can maintain temperature up to 2 to 4 hours. It can maintain temperature up to ice pack can maintain temperature up to can maintain temperature up to 2 to 4 hours. And ice pack is usually used at which level? Ice pack is usually used at which level? Sub-center or village level. It is used at which level? Ice pack is usually used at which level? Mainly at village levels, because at sub-centers at least we have this one. The second one that you just a minute. The second one that you can see, at least as sub-center we have these ones, these blue boxes, and these blue boxes are known as vaccine carriers. These blue boxes are known as बचपन में किसी को अगर देखा होगा पल्स पोलियो डे पे, the sisters usually or the Anganwadi workers usually carry this vaccine carrier. Vaccine carrier can contain how many ice packs? It can contain how many ice packs? It can contain how many ice packs? And how many vaccine vials? How many vaccine vials? 16 to 20 vaccine vials. So a vaccine carrier can contain how many ice packs? And how many vials? How many vials? एक वैक्सीन कैरियर में it can hold up to 16 to 20 vaccine vials or 4 ice packs. Okay, no issues till here. I hope this is clear. And vaccine carrier is used at level of sub-center or village. Vaccine carrier is used at level of So please remember, at sub-center of village for cold chain maintenance we can use 2 things. First is this vaccine carrier or the ice pack. No issues in this. Now tell me a one-liner, and this was a question. Maximum failure chances in cold chain are seen at which level? Maximum failure chances in cold chain are seen at. So अगर level पूछी गई है, maximum failure chances at which level? So the answer should be, if you need to mark one, village or sub-center. अगर sub-center option में होगा, that would be the second choice then. Please remember, village पे सबसे ज़्यादा होता है. Okay, so maximum failure chances at which level? Village. Maximum failure chances at which level? Village. If not village, then sub-center. Or if they ask you about the instruments, then maximum failure chances are recorded at ice pack level. Maximum failure chances in. No issues till here. I hope this is clear. This was a question which has been asked. Maximum failure chances in cold chain at which level? Village level. Maximum failure chances in cold chain due to which instrument? No issue. Moving further. Now talking about this logo. आग बनी हुई है और क्या चाहिए तुम्हें? Okay, this is the only program that is the national program for control of blindness and visual impairment. This is the national program for control of blindness and visual impairment. आग बनी हुई है, easy, no issues here. Okay. Then one-liners from this program would be, first of all, Most common cause of blindness they can ask you. Most common cause of blindness? Optha हुआ है अभी. Most common cause of blindness is followed by most common cause of blindness. Second most common cause of blindness. The important, okay. Then can anybody tell me sorry, blindness की अगर बात करो, what is the WHO definition of blindness? Vision less than is considered blindness according to WHO. I hope this is clear. This is also a question which has been asked. Sometimes they can ask you questions from economic blindness, legal blindness, or social blindness. So social blindness is less than 3/60. Social blindness is economic blindness is 6/60. Economic blindness is पैसे कमाना कब बंद करेगा? जब थोड़ा बहुत भी धुंधला दिखेगा. He could not earn money, right? So economic blindness would be less than social blindness less than, and legal blindness less than 1/60. Legal blindness less than. WHO definition of blindness is vision less than. At least remember this. If you could not remember others, at least remember this. Then what is the prevalence of blindness? Anybody? 0.36%. What is the prevalence of blindness? What is the prevalence of blindness in India? 0.36%. Important. And there is a target or a goal according to this program to reduce it to less than 0.3%. Okay, there is a target or goal to reduce it to less than 0.3%. Important one. Sorry. Then moving further, before moving further, just tell me one important thing. A one-liner again from Biochem also and from PSM also. Most common cause of preventable blindness. Most common cause of preventable blindness. Very good. It is vitamin A deficiency. Most common cause of preventable blindness is vitamin A deficiency known as xerophthalmia. X1B is for Bitot spots. X1B for most common symptom is night blindness or nyctalopia. Most common sign is conjunctival xerosis. Most common sign is conjunctival xerosis. No issue. यही questions usually आते हैं PSM से भी. ठीक है? I hope this is clear to all of you now. Moving further. Now, what is this logo for? So this is the logo for Arogya Setu app. This is the logo for Arogya Setu app. It is a mobile application designed by the government of India with the help of Ministry of Health and Family Welfare to actually help the patients during the COVID-19 pandemic. Okay, it usually has a function of self-assessment. Okay, important. It has a function of self-assessment. Okay, इधर tagline usually होगी आरोग्य सेतु would not be option. इधर tagline होगी मैं सुरक्षित, हम सुरक्षित, भारत सुरक्षित. ठीक है? I hope this is clear. Yes. Moving further, then a very close to my heart one, that is ESI. That is ESIC, Employee State Insurance Corporation. ठीक है? So this is the logo for Employee State Insurance Corporation. So this Employee State Insurance Corporation comes under which ministry? Ministry of Labor. It comes under Ministry of ESIC comes under Ministry of Labor. Okay, so ESIC, Employee State Insurance Corporation, was actually formed after the ESI Act of 1940. Okay, and according to this, there were different ESI hospitals which were established in all parts of India. Okay, and in this ESI hospitals usually health benefits or health cover is given for the people who are covered under the scheme. And who are the people covered under the scheme? Usually the people having a salary of less than 21,000 who work in factories or companies other than the government ones. I hope this is clear. No issues. ठीक है. At least समझ लो. अगर नहीं समझ में आता तो at least ये one liner से याद रखो. It comes under which ministry? मिनिस्ट्री ऑफ लेबर। ओके, कंट्रीब्यूशन, इस पे बार बार क्वेश्चन आया है, यू नीड टू रिमेंबर दिस। सो नाउ अकॉर्डिंग टू दिस स्कीम यूजुअली द एम्प्लॉयर मतलब जो काम कर रहा है एंड एम्प्लॉय मतलब जो मालिक है, ओके, बोथ ऑफ देम नीड टू पे सम अमाउंट टू द ईएसआईसी कॉर्पोरेशन, ओके, अंडर व्हिच दे विल प्रोवाइड यू दिस हेल्थ कवर, ओके। So every month usually this amount is cut from their salaries. So employer pays how much? Employer means मालिक होता है, employer pays 3.25% of the wages. Employer pays whereas employee pays 0.75% of the wages. Employee pays employer pays so totally it becomes 4% of wages, ठीक है। previously it was different, इसीलिए बन सकता है, ठीक है, previously it was different, 4.75 वगैरह था। moving further, one liners again, sickness benefit under ESIC कितना होता है? 91 days. Sickness benefit under ESIC is given for 91 days. Extended sickness benefit मतलब in chronic conditions usually like tuberculosis वगैरह, extended sickness benefit under ESIC is given for extended sickness benefit for and maternity benefit. It is not only for ESIC, rather for all the companies it is mandatory to give a maternity benefit of 26 weeks or 6 months. 26 weeks or so employer means जो मालिक है, जो कंपनी है, that is the employer. Employee means the one who works for him, ठीक है। employee मतलब जो नौकर है, जो काम कर रहा है बंदा, ठीक है। I hope this is fine. So employee pays sickness benefit for this was the question which has been asked. Extended sickness benefit for maternal sickness benefit for 6 months, okay. Yes, most common cause of preventable blindness अगर पूछा जाए, overall it is vitamin A deficiency because mostly preventable blindness is usually common in children. अगर adults में specifically पूछा जाए then it would be trachoma, ठीक है। Overall, if you need to answer, it is vitamin A deficiency. I hope this is clear. Moving further now, this is the logo for Ministry of Women and Child Development. Smriti Irani, Ministry of Women and Child Development. ठीक है? So under this ministry, usually they have a scheme which sounds similar to the other one, and this scheme is known as the Ujjwala scheme. This scheme is known as the Ujjwala scheme, which is actually to prevent, rescue and rehabilitate the victims of child trafficking. It is for prevention of child trafficking. Usually these the children who are kidnapped, they are usually then used for sexual exploitation, ठीक है। So important one. So Ujjwala scheme for it comes under which ministry? Women and Child Development. Next is this one. This logo goes for Ujjwala scheme. This logo goes for Ujjwala scheme or Ujjwala Yojana. Under this Ujjwala scheme or Ujjwala Yojana or Pradhan Mantri Ujjwala Yojana, usually the females are given free LPG connection. They are given free LPG connection and subsidized LPG cylinders. I hope this all of you are quite aware of, right? So this is your Ujjwala scheme, ठीक है। Ujjwala for and Ujjwala for LPG, ठीक है, याद रखना। There is one more Ujjala, नाम से ही पता चल रहा है, that is for LED bulb, Ujjala रोशनी, ठीक है। Next one, this was a question in August 2020. किसी को कुछ पता नहीं था, क्या था ये? Then also we tried to mark तुक्का था रहेगा बिल्कुल। That is for Bureau of Indian Standards. This logo stands for BIS, Bureau of Indian Standards. The blue one stands for Bureau of Indian Standards. BIS. Only Manakaha Pata Pradarshakaha was given. Okay. So BIS or Bureau of Indian Standards is actually a subunit or the authority under the government of India where they actually standardize, okay, where they actually set a mark for standardization for all the products, ठीक है, for every product. Okay, mark of standardization is set at BIS, that is Bureau of Indian Standards. Important logo एक ही बार आया था. The next one, the yellow one that we have, it is AGMARK. It is the logo for, this is the logo for, so नाम से पता चल रहा है, it is a standardization logo for agricultural products. It is a standardization logo for, it is a standardization logo for, इसीलिए AGMARK बोला गया उसको, ठीक है, important. And one more is ISI mark, which we find on every other industrial product. Indian Standards Institution. ISI सबको पता है, right? Next is this Food Safety and Standards Authority of India. This is what Food Safety and Standards Authority of India. Important one. It is usually a multi-ministerial scheme, but majorly it was started by the Ministry of Health and Family Welfare. Majorly it was started by the Ministry of Health and Family Welfare. Food Safety and Standards Authority of India. ठीक है, it comes under which ministry? Ministry of Health and Family Welfare. MA Political Science नहीं पता क्या? नहीं समझो. Next, अभी ये दो दोस्त तुम्हारे, पहला वाला कौन है? ये वाला कौन है? Jon Snow. The first one is Jon Snow, and Jon Snow is known as father of. Jon Snow is known as father of. Jon Snow is known as father of. Who is known as father of epidemiology? Father of modern epidemiology भी. Father of modern epidemiology भी. Jon Snow. He worked on which disease? He worked on which disease? He worked on which disease? Cholera. ठीक है, and therefore cholera is regarded as father of. Cholera is known as father of. Cholera is known as father of. Father of public health. Father of epidemiology. Jon Snow. No issues till here. National Institute of Epidemiology is located in Chennai. National Institute of Epidemiology है. National Institute of Epidemiology है. One line you need to know. Okay, father of medicine. Hippocrates. Father of medicine. Hippocrates. Next stylish gentleman, a French one. और ये जानना बहुत important है, because once a question came that where did Sir Louis Pasteur die? So Sir Louis Pasteur died in France. Okay, because he was a French microbiologist. ठीक है, ऐसे याद रख लेना. So ये question आया था, पता नहीं क्या सोच रहा था, but आया था. So he is Sir Louis Pasteur. He is Sir Louis Pasteur. And Louis Pasteur gave which theory of disease? Which theory of disease? अरे which theory of disease? Very good. Germ theory of disease. He gave which theory of disease? Louis Pasteur gave which theory of disease? He said for every disease there is some pathogen which is responsible. अपने आप नहीं होता है. Okay, so he gave the germ theory of disease. Then he gave which method of disinfection? He gave which method of disinfection? He gave which method of disinfection? Pasteurization. And he discovered 3 vaccines, remembered as CAR vaccines, remembered as C for A for R for rabies. Okay, I hope this is fine. ठीक है. So Louis Pasteur discovered 3 vaccines. C for A for R for, हमारे पास लोग हैं वो बोल रहे C for car. ठीक है. So important. And Louis Pasteur is known as father of microbiology. I hope this is fine. Father of bacteriology is Robert Koch. Father of bacteriology is Robert Koch. An important thing to remember that, please remember, cholera vaccine was discovered by. But Vibrio cholerae organism was discovered by Koch. कौन था? जॉन स्नो. Vibrio cholerae organism was discovered by. mycobacterium TB was discovered by Robert Koch and therefore is considered father of bacteriology. ठीक है, no issues. Vaccine इसका नाम आएगा, organism कोच का नाम आएगा. No issues till here. Now please tell me father of vaccination किसे बोला जाता है? Father of vaccination is and Edward Jenner discovered which vaccine? Smallpox. Important. I hope this is fine with everybody. Moving further. Now talking about a very important aspect and it is biomedical waste management. ठीक है? So if we talk about biomedical waste management, a question every time, one question compulsory from biomedical waste. ठीक है? So we have yellow bag, red bag, a white transparent or a translucent container, a blue box, okay, or a cardboard box is also used instead of a blue box अगर गरीबी है तो. Or lastly we have a black bag also. And in INS-CET this time black bag was asked. ठीक है? Important. So now in yellow bag which type of waste is discarded? So usually in yellow bag we discard solid waste. Any solid waste which is solid with bodily secretion. Any solid waste which is solid with blood, serum, semen, anything. Okay, all this waste to be discarded in yellow bag. Okay, so usually we discard anatomical parts of humans. Okay, anatomical parts of humans, any animal. Okay, or any parts like placenta, plaster of Paris, any bandages, dressings, gauze pieces. Okay, all of that. Any pathological waste, then cotton waste, dressing materials, beddings, mattresses, linens. Okay, all of that. Then body contaminated fluid, paper cloths वगैरह, face mask and cap, because face mask and cap are contaminated. अगर कोविड का क्वेश्चन आता है, face mask and cap are to be discarded है, face mask and cap are to be discarded है, face mask and cap to be discarded है, yellow bag. Then also we discard cytotoxic waste like expired medicines, discarded medicines, okay, and microbiological waste like culture media वगैरह. So I'll ask you questions. पहले तो सब कर रहे थे, then I'll ask you. It would be better. So yellow bag usually ये सब waste जाता है, and then yellow bags is discarded by which method of disinfection? Incineration. It is discarded by incineration. ये question आया था. And incineration works at what temperature? More than 1200 degrees centigrade. Incineration works at more than 1200 degrees Celsius. ठीक है, no issues. Then coming to red bag. Red bag usually contains recyclable waste. Red bag usually contains recyclable waste like plastics or rubbers. So any plastic syringes without the needles, IV sets, IV cannulas, okay, without needles again, catheters, gloves, whether they are stained or whether they are unstained does not matter. They will always and always go in. Gloves always and always go in. So याद रखना, whether they say stained gloves, then also red bag. Then urine bags usually, okay, dialysis kit, IV bottles, all of these are plastic materials. Catheter like Foley's catheter, Rice tube, everything goes in red bag because this plastic is usually recycled. Okay, and this plastic, first of all, these waste is treated with autoclaving, hydroclaving or microwaving, and then it is usually recycled. First it is treated and then it is recycled. ठीक है? Come again? Bed stain gloves. Blood stain also goes in red. That's what I am telling you. Blood stain also go in red. Important thing. Okay. So in hospitals also most of us do this mistake. Please remember it is red bag for any kind of gloves. ठीक है? Moving for the next one. White translucent container is usually for sharps like needles, syringes usually having fixed needles, the ones we use for insulin, okay, or blades or scalpels, surgical blades or scalpels. All of these will go in white translucent container. And last is your blue box or cardboard box, which usually contains waste like metallic or glassware, glassware, okay, any broken glass, ampules, vials, lab slides, okay, any orthopedic implant, pacemakers, everything goes in blue box. And lastly, black bag will contain Kachra, that is general waste. Black bag contains general waste. So now, ready for a quiz? Rapid quiz. Jaldi jaldi. Starting. Placenta. Placenta. Amputated hand. Amputated hand. Blood stained gloves. Blood stained gloves. Blood stained linen. Linen kapda. Blood stained linen. Blood stained linen. Beddings. Beddings. Mattresses. Dressings. Gauze pieces. IV set. IV set. IV set. Urine bag. Plastics. Plastics. Catheters. Catheters. RT. Rice tube. Needles. Needles. Syringes. 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 Syringes with fixed needles. Syringes with fixed needles. Surgical blade. Surgical blade. Scalpels. Broken glass. Broken glass. Wires. Wires. Ampules. Metallic body implants. Pacemakers. I hope this is fine. And a question from INI-CET. Covers of gloves will go in. Covers of gloves will go in. Black. Cover, yellow and wrappers. So it usually contains wrappers. This was a question of recent INI-CET. Wrappers or covers of any of the like instruments or anything will go in a black bag. No issues till here. And important, black is a bag, yellow is a bag, red is a bag, but white and blue are containers or boxes. No issues. I hope this is fine. And sharps are to be discarded by the method of shredding. First they are treated again with autoclaving vagara, and then they are shredded, and then they go to sharp pits or landfills. Okay. And blue box is usually treated by metallic या glassware. क्या होता है इनका? Recycling. Metallic or glassware are recycled. So we have two bags of recyclable waste. First was red, and second is so yellow is discarded by red is discarded by recycling. Red is discarded by blue by white by. No issues till here. I hope this is fine. Now moving further. अब ये बता दो, mercury is to be discarded by mercury which is in the thermometers. ये question आया था. Very good. क्या? That is R3. R3 for mercury. That means we recollect, we recycle, and we reuse. So what is to be done with mercury? Mercury, recollect, recycle, reuse. Mercury, कोई इशू नहीं है यहाँ पे. Whereas the broken thermometer will go in blue contains glassware. Important. Okay, next, radioactive waste is discarded by. This was a question. Radioactive waste is discarded by C. burial. Radioactive waste is discarded by. It is dumped in the sea, in middle of the sea. Radioactive waste. Okay. A very common and important question. A nurse spills some blood while inserting an IV cannula. It is to be treated with 1% sodium hypochlorite. Blood spills 1% sodium hypochlorite. Blood spills 1% sodium hypochlorite is used for. No issues. I hope it is fine. Then endoscopes के लिए, just for my knowledge. Very good. It is Sidex, also known as 2% glutaraldehyde. It is also known as Sidex or 2% glutaraldehyde. Endoscopes, Sidex or 2% glutaraldehyde. Blood spills, radioactive waste is disposed of by mercury is to be recollected, recycled and reused. Then an important method of disinfection. And what is this? Very good. This is autoclave. This is a pressure cooker जैसा लग रहा है ना? So what is the principle of autoclave? Steam under pressure. What is the principle of autoclave? What is the principle of autoclave? Steam under pressure. Important. Principle of autoclave is temperature of autoclave. Important. 121 degrees Celsius. Temperature of autoclave is for how much time? For how much time? For in how much pressure? In how much pressure? 15 psi, that is 15 pounds square inch. No issues. Pressure is 15 psi. Pressure is, duration is, temperature is, principle is, and the control. A question which has been asked. Control is Geobacillus styrothermophilus. Control organism is, control organism for autoclave is, control organism for autoclave is Geobacillus styrothermophilus. ठीक है, no issues. Then BSL, that is your biosafety level. ठीक है, so we have how much biosafety levels? 4 biosafety levels. Okay, biosafety level 1 is for non-pathogenic strains. Okay, for routine examination. Whereas biosafety level 4 is the highest one. Usually for dangerous viruses or the newly emerging viruses. ठीक है, viruses या फिर organisms. Then BSL for COVID. BSL for COVID is very good. BSL for COVID are 2 important ones. याद रखना, if it is a routine examination, BSL for COVID, it is a routine examination, then it is BSL. For routine examination it is. But for isolation of the virus it is. So BSL are nothing but safety protocols that are to be actually observed while working along with the organism, because there is a high risk of spreading this organism, right? So that are biosafety levels which was not maintained in the Wuhan lab of China. ठीक है? हाँ ना, ये चल रहा था ना उस पे, वर्क तो चल रहा था. They have actually agreed on that, right? So अब क्या चल रहा था, I was not sure. Moving further, BSL for COVID, for routine examination it is. For isolation of virus it is. No issues till here. BSL 4 is for harmful organisms. Anybody? At least दो याद रख लो, Ebola and Marburg. BSL 4 for Hanta virus, Nipah virus, वो all of them come in BSL 4 only. So BSL is for BSL 4 is for Ebola and Marburg-like organisms. ठीक है? I hope there is no issue with this. Then talking about triage, an important question. One question from disaster is compulsory always. ठीक है ना? So if we talk about disaster, first of all, we need to go to the disaster site. Okay, and the paramedics usually they try to segregate the patient, right? They try to segregate or they categorize the patient, and this segregation of patients is known as. And this segregation of patients is done on the situation of the patient, on the likelihood of survival. It is done on the basis of likelihood of survival. ये जिंदा बच सकता है या नहीं बच सकता, उस पे हम actually categorize करते हैं. Okay, I hope this is clear. It is done on the basis of likelihood of survival. Important. Then highest priority is given to highest priority, high priority. Also sometimes it is blue. High priority, low priority, and least priority, black. So usually in red we have patients who need immediate resuscitation, or need a life or a limb saving surgery within. Then high category, that is yellow or blue, here the patient would require a limb or life surgery within Within 24 hours. Within. Then in green we usually have ambulatory patients. In green we usually have. So these patients are just with minor injuries. Those who need stitches, okay, or those who need just dressings. These are ambulatory. Means these are roaming from here and there in the hospitals. Okay. So these are ambulatory patients. And last, black patients. They will not give you directly dead. याद रखना, they will either give you moribund or they will give you unsalvageable. मतलब जिसको बचाया नहीं जा सकता, तुम कितने भी हाथ पैर मार लो. ओके, सो ब्लैक प्रायोरिटी इज फॉर, सॉरी, ब्लैक कैटेगरी इज फॉर moribund or unsalvageable. Moribund or unsalvageable or dead. Moribund or unsalvageable patients comes under black category. Ambulatory patients under ambulatory under within 24 hours surgery under within 6 hours surgery under immediate resuscitation under red. I hope this is fine. Highest category is highest priority is for and least priority is for black. Then talking about reverse triage. So reverse triage is done for in cases of wars for soldiers. Reverse triage is followed in wars. This was a question which has been asked. It is done for soldiers usually. So in times of wars, green is given the highest priority because we need these soldiers to come back to the warfare battlefield again. Okay, that's the reason. Moving further, now talking about post-disaster, please tell me which is the most common disease post-disaster? Acute gastroenteritis. Most common disease post-disaster is? Most common disease post-disaster is? Most common disease post-disaster is? Acute gastroenteritis. And what is the most important preliminary state in a post-disaster phase? Very good. Most important preliminary state क्या होगी तुम्हारी? Most important preliminary state should be. So you will actually try to chlorinate all the water facilities which are available. Okay, because there is a higher risk of water-based diseases after a disaster, right? And that is the risk for acute gastroenteritis also. So the first most important preliminary state in post-disaster phases, most important preliminary state in post-disaster phases, chlorination of water bodies. Next, if in case a disaster occurs, okay, so this is managed by a National Disaster Management Authority, for which the chairperson is. Very good. It is the Prime Minister. For NDMA, National Disaster Management Authority, the chairperson is National Disaster Management Authority. Chairperson is Prime Minister. Please remember this. Okay. And it is usually managed at which center? What is the nodal center? District is the nodal center. District is the. So for any cases of medical health, rehabilitation services, sanitation services, they will be provided by the district collector himself. ठीक है? He will be the one responsible. So the nodal center in disaster is. 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 Ministry responsible would be. Ministry responsible would be Home Affairs. Ministry responsible is. Ministry responsible is. But the chairperson is. Disaster is a tragedious condition. ठीक है ना? Therefore, Prime Minister is the ultimate authority for these conditions. ठीक है? Then worst man-made disaster. This was a question. Very good. It was the Bhopal gas tragedy. Worst man-made disaster was. Worst man-made disaster was. Worst man-made disaster was Bhopal gas tragedy, and then it was due to exposure to methyl isocyanate. It was due to exposure to. It was due to exposure to methyl isocyanate. Moving further, talking about demography now. So crude birth rate. Okay, crude birth rate is what? Total number of births upon total population into 100. That is what is your crude birth rate. Okay, important one. What is the crude birth rate of India? Crude birth rate of India is. Crude birth rate of India is 20.2 according to SRS 20. Crude birth rate of India is. Crude birth rate of India is. Crude death rate of India is. Crude death rate of India is. Crude death rate of India is. Then growth rate, also known as. Growth rate is also known as the. Growth rate is also known as the demographic gap. Growth rate is also known as Growth rate is also known as demographic gap. It is nothing but the difference between the crude birth rate and the crude death rate. So the formula is crude birth rate minus the crude death rate. That is what gives us the growth rate or the demographic gap. What is the current growth rate of India? If I ask you about annual growth rate, हर साल कितनी population बढ़ती है हमारी? It is 1.64%. Annual growth rate of India is? Annual growth rate of India is? Annual growth rate of India is? And that's the reason why India is in the very rapid growth phase. India is in the very rapid growth phase. I hope this is fine. Then there are stages of demographic cycle. I hope all of you are quite aware of demographic cycle, right? So demographic cycle की कितनी stages होती है? 5 stages of demographic cycle. Now there are demographic cycle में usually we plot a graph of crude death rate and a crude birth rate. ठीक है? So the difference is known as the demographic gap, right? So maximum demographic gap is seen in, I have explained this already in previous classes. Maximum demographic gap in, at least रख लो one liners की तरह रख लो इनको. Late stage 2. Maximum demographic gap है. Maximum demographic gap है. Maximum demographic gap है. Minimum demographic gap है. Stage 1 and 4. Minimum demographic gap है. Minimum demographic gap है. Because these are stationary stages. Please remember. Minimum demographic gap. Minimum demographic gap. Minimum demographic gap. Maximum demographic gap. Late stage 2. Whereas contraction of demographic graph starts at early stage 3. Contraction of demographic graph starts at. Contraction starts at. I hope this is fine. And negative demographic gap, when it means when the crude death rate is more than the crude birth rate. जितने पैदा कर रहे हो उससे ज़्यादा मर रहा है. Okay, that is what is a negative demographic gap. It is seen in stage. Now tell me, India is in which phase or which stage of demographic cycle? Stage 3. India is also known as the late expanding stage. It is also known as the. I hope all of you are quite aware of demography. If not, at least see once the image from FMG snaps for your demographic cycle, because I have already explained it, so I have not included it over here. Okay, please remember. Maximum demographic gap. Maximum demographic gap. Minimum demographic gap. Minimum demographic gap. Contraction starts. Negative demographic gap. India is there. And stage 3 is also known as late expanding stage. Important. Okay. Then total fertility rate, TFR. It is also known as completed family size. Total fertility rate is also known as. Total fertility rate मतलब the total number of children born to a woman in her entire reproductive lifespan. That is total fertility. कितनी fertility हुई उसकी, कितने बच्चे पैदा हुए उसको. That is total fertility. I hope this is fine, right? And the current TFR of India we discussed, it was 2.2. Current TFR of India is. And according to NHM, there is a target to decrease this TFR to. to 2.1. And to achieve this to a TFR of 2.1, NRR should be, that is net reproduction rate should be. NRR should be. And for NRR of 1, couple production rate should be. 60%. Couple production rate should be. I hope at least ये line तुम याद रख सकते हो. Then which is the best demographic indicator? Now there are multiple demographic indicators like TFR, GFR, GMFR, okay, crude birth rate, crude death rate. All of these are demographic indicators. So which is the best demographic indicator out of all? Best demographic indicator out of all is the only indicator in which mortality is taken into account. That means कितने मरे हैं बच्चे वो भी ध्यान में लिया जाता है. So that is your net reproduction rate, in which only the live number of girl children are counted. Net reproduction rate means live number of girl children. Net reproduction rate means Net reproduction rate means live number of girl children, कितनी जिंदा है अभी. Okay, so best demographic indicator है, best demographic indicator है, best demographic indicator है. Don't forget this. Okay, this was a question. What is dependency ratio? Non-earning population upon earning population. What is dependency ratio? Dependency ratio है, dependency ratio है. Non-earning population is considered less than 15 years and more than 65 years. And denominator में आएगा 15 to 65 years. I hope this is fine. Dependency ratio का once formula they had asked, so this is the formula. Next, first census. Census is the best data collecting system that we have right now. It is a decadal data system. That means it is conducted every 10 years. Important. Okay. First census was conducted in the year. First census was conducted in the year 18. The first census was conducted in the year. First census was conducted in the year 1871. First census है. First census है. First census है. First census है. First disability census है. Next census. Disability census was 1881. First disability census. First disability census. First census. First census. First disability census. No issue. Then the year of Great Indian Divide or the year of Big Indian Divide. The only time the Indian population was declining was the year. It was the year 1921 due to plague in 1920. COVID में भी ऐसा ही होगा भी, ठीक है? So नहीं हो रहा. So the year of Big or Great Indian Divide was. The year of Big or Great Indian Divide was. The year of Big or Great Indian Divide was. Then census is usually, census or all this data collecting system comes under which ministry? This comes under which ministry? This comes under which ministry? Home Affairs Ministry. Then talking about sex ratio. Sex ratio is number of females per thousand. Sex ratio is number of females per thousand males. And what is the current sex ratio of India according to census 2011? 46 कहाँ से आया अभी नया? 943. Current sex ratio of India is? Current sex ratio of India is? Current sex ratio of India is? Highest in the state of? Highest in the state of Kerala. Highest in the state of? Highest in the state of? Lowest in? State of Haryana, but overall Diu and Daman territory. Lowest in Diu and Daman territory, but lowest in the state of Haryana. Then if we talk about child sex ratio, child sex ratio में girls till what age are taken into account? Females of 0 to 6 years. Females of 0 to and males of 0 to into multiplier 1000. So this is the child sex ratio. Number of females from 0 to 6 years upon number of males from 0 to 6 years into 1000. And what is the child sex ratio of India currently? Census 2011. What is the current child sex ratio of India? What is the current child sex ratio of India? 919. Okay, important. No, not Uttarakhand. It is Haryana. Important. Okay, it is Haryana. Followed by most. अगर lowest पूछा तो Diu and Daman, but if this specifically asked about a state, then it should be Haryana. Then literacy rate is what? Number of literates upon total population, but more than 7 years into 100. What is literacy rate? Total number of literates upon total population more than 7 years into 100. Important one. Okay. And what is the current literacy rate of India? 74%. Current literacy rate of India is 74%. Okay. I hope this is fine. Moving further. Next one. Which is the most accurate data collect? ये करके जब घर चले जाना. अब बस ये कर लो. Demography तो खत्म करो. Most accurate data collecting system is? Most accurate data collecting system is? SRS, Sample Registration Survey, because it is the only dual data collecting system which is conducted every. So most accurate data collecting system is Most accurate data collecting system is, it is conducted every, and a question in December 2020 was asked. SRS includes all except, that was a controversial question, and the High Court has told that please remember IMR, MMR, crude birth rate, crude death rate, all are being calculated by SRS. So there is no exception. Okay, NB stated that IMR is an exception, but they said no, the Census Commissioner of India gave it in return that MMR is not an exception. Okay? Then vital registration system is usually for registration of marriage, birth and death. Marriage should be registered with it. 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 Birth and death should be registered with it. The birth and death should be registered with it. The birth and death should be registered with it. 21 days. This was a question which had come earlier. Next, population pyramid. It is a pyramidal shape in which countries? Developing or developed? Pyramidal shape. Pyramidal shape. Pyramidal shape. Pyramidal shape. And spindle shaped. Spindle shaped. Okay. Then if we talk about health communication, there are two methods of health communication. One-way method of communication known as didactic method of communication, and two-way method of communication known as Socratic communication. I hope this is fine. This is the image that can come in examination. What is this image of? This is a focus group discussion ka sociogram. This image is of a sociogram. This image is of a. This image is of a. This image is of a. And sociogram is plotted in focus group discussion. Sociogram is plotted in. Sociogram is plotted in focus group discussion. Okay, which is a two-way method or Socratic method of communication. Important. Okay. Lecture is which method of communication? Lecture. Questions are not allowed in lecture. So lecture is a one-way method of communication. And best method of communication, health communication would be. Best method of health communication would be interpersonal communication. That is one-to-one communication. A doctor and patient talking one-to-one. That is the best method of communication. So best method of communication is. Best method of communication is. IPC बोल दो ठीक है. So with this I end the session for today. Tomorrow and day after tomorrow most likely there will be PSM 2 more sessions and then we'll wind up PSM. Thank you so much. Goodbye. Goodbye.